It's a proud privilege to have Dr. Mohanan Kunnummal, the Vice Chancellor of Kerala University of Health Sciences with us. Sir is very beloved to us. He was initially with the Kerala Government Medical Services. From that time, I first met Sir during the time of the Best Doctor Awards. And before that also, he was the legendary leader of KGM CTA. We are indeed proud, sir, that you are here. Please, sir, come on stage. And
Good afternoon. Thank you, Devin, and the leaders of the medical profession in the state. I'm extremely happy to be here in the 49th conference of QPMPA. QPMPA, as I understand, represents the private sector in healthcare profession in the state. And as we all know, almost 60 to 70% of the patients in Kerala are taken care by the private sector. And so this is such a huge sector. Unfortunately, it is not getting sufficient attention, sufficient support, sufficient care we expect. And one very big phenomenon that is happening in healthcare is that small and medium type hospitals are being closed. In fact, when we were all students, when I passed out from Trivandrum Medical College as an MBBS graduate, the option before us, most of us, was to go somewhere where there are no doctors and start a clinic. And this is what being done. In fact, I was also thinking of that. Then I landed into a medical college and then I became a radiologist. Otherwise, I also would have started a small clinic. Then subsequently, it would have become a medium-type hospital. And maybe I am out of that, or maybe I will be sitting here. This would have been the future. But now we realize, especially from the university side also, now we are, in fact, producing roughly about 5,000 doctors from Kerala, 5,000 doctors. And that is a part of the 1 lakh doctors being produced in India. And what are they doing? They are writing the NEET examination, and next year they will write next examination. Why they are writing NEET examination? Of course, many of them want to have a post-graduation. But many of them are writing NEET examination because they don't want to practice immediately. They are not confident enough to start a clinic. And they are not willing to join a big hospital also. So this is an issue. And many of those who take their post-graduation, then they continuously write examinations, the NEET examination for super specialty. They are not willing to start their own a clinic, their own a hospital. This is a real issue. I don't know whether people have addressed. Now, the NMC has come out with a new ethics regulation. One line, a registered medical practitioner should preserve the records of the patients he has seen for 3 years. I think if somebody is starting to start a clinic by himself, by reading this, he will immediately stop this. How are you going to keep? So you can think about a big hospital, corporate hospital, they all can do. And it says that you should digitalize everything. Everything can be digitalized. It's perfect. But then these are issues. Now, attack on the hospitals and attack on doctors. Recently, we lost our student. I will say that Dr. Vandana Das was a student of Kerala University of Health Sciences, and I call her as our daughter. When she was stabbed on that day, early morning, I called Dr. Sahadullah, how is our child? Early morning I called. Then he said nothing can be done. She's no more. Then immediately the university, the supreme authority of the university is the governor, the chancellor. Early morning I called him. This has happened. And you know what he said? I'm straight away going to the hospital. And the governor went to the hospital. And then I did not know what else to do. Because there is no law to protect the doctors. Everybody says. So I consulted the university's advocate. Can we file a case? And he said, let us try. So he met the High Court Chief Justice. At that time, there was no sitting because that is a vacation time. And the Chief Justice said, do you want the sitting today or tomorrow? Then the advocate called me. The chief is asking, do you want the sitting today or tomorrow? I said, I want the sitting today. And at 1:30, on that fateful day, the Honorable Court met and said, this law must be created immediately. And when you draft this law, include the university also. Then authorities in the government asked, where did you file a case? I said, my child died. And then within 2 days, the drafting committee was constituted. I was also in the drafting committee, and of course this came, and now the assembly also has passed the. So this is how the university interferes in this with whatever little power we have. Now the law is there, passed by the assembly, but then we should see that it is being implemented in letter and spirit. And we will call this as the Vandana law. And this Vandana law should be implemented in letter and spirit. Why we are saying that this should be? Of course, it is to protect us. More than that, it is to protect the health care in the state. Why people are not trying to have their own hospitals? Because they are afraid. They are afraid what will happen to them. They are afraid how the law will take care of them. Who will protect them? These are the issues. And I'm very sure that the so-called Kerala model, everything will collapse if the small and medium type hospitals in Kerala are protected. See, I've been telling many authorities, you have an aided school. Government pays the entire salary, and the management, of course, take the money from the teachers and then appoint them. Anyway, but there are teachers who are teaching, and for the student, they get free teaching. The aided schools in Kerala, it's a unique model in Kerala. We have aided schools, aided colleges. Almost all big name like Marivanas, MG, all these are aided colleges. Who pays the salary? Government of Kerala. And of course, the management gets the credit because their college, they appoint the teachers. Some of them take money also. But student gets benefit. Why don't we have aided hospitals? It is more life supporting than anything else. You can have multiple small and medium hospitals. Government can supply the drugs. Government can supply the infrastructure. You need not pay the salary. The doctor may get payment from the patient. So this kind of model is the only alternative to the crisis we are facing now. We will have big hospitals. We will have corporate hospitals. That will be there. But that cannot take care of the need of the entire population. Of course, if the government has got like the UK system, NHS, where you have hospitals which will take care of every citizen and you have 100% insurance fire, are we going to have it? It cannot. It will not. It will never come, at least in the next 25, 30 years. So the alternative solution, in-between solution probably is an aided hospital where a young graduate is supported so that he gets confidence that he will be taken care and the patient is assured of a free treatment. These kind of alternatives, I think UPMP should discuss. Thank you. With these words, I wish you the very best.